Hi, my name is Andy. In June of 2010, I had a herniated and torn disc that ended up changing my life forever. It caused a condition known as Cauda Equina Syndrome. I lost all sensation from the waist down and had to undergo emergency spinal surgery to remove the shattered disc. Here is a description of Cauda Equina Syndrome. Please tell everyone you know about it. Cauda Equina Syndrome, CES, is a serious neurological condition resulting from the compression of the cauda equina, a bundle of spinal nerves and nerve roots at the lower end of the spinal cord. This condition is a medical emergency due to the potential for permanent nerve damage, which can lead to significant impairment in bladder and bowel function, sexual dysfunction, and loss of sensation or motor control in the lower limbs. CES can be caused by various factors, including herniated discs, spinal stenosis, tumors, infections, trauma, or inflammatory conditions. The hallmark symptoms of Cauda Equina Syndrome include severe low back pain, sciatica, saddle anesthesia, numbness in the areas that would contact a saddle, such as the inner thighs, buttocks, and perineum, and varying degrees of motor weakness and sensory loss in the lower extremities. Patients often present with bladder and bowel dysfunction, such as urinary retention, incontinence, or a loss of the ability to sense the need to urinate or defecate. The progression of these symptoms can be rapid, and early diagnosis and intervention are crucial to prevent irreversible damage. Diagnosis of CES involves a combination of clinical evaluation and imaging studies, primarily magnetic resonance imaging, MRI, which provides detailed views of the spinal cord and surrounding structures. Treatment typically requires urgent surgical decompression to relieve the pressure on the cauda equina nerves. The timing of surgery is critical. The best outcomes are associated with decompression performed within 48 hours of symptom onset. Postoperative care focuses on rehabilitation and managing any residual symptoms. Patients recovering from Cauda Equina Syndrome often need multidisciplinary support, including physical therapy, occupational therapy, and possibly counseling to address the emotional and psychological impacts of the condition. Long-term prognosis varies and depends on the extent of nerve damage before intervention. Early recognition and prompt surgical treatment are key to improving outcomes and minimizing long-term disabilities associated with Cauda Equina Syndrome. Remember to be aware of this condition. If it can happen to me, it can happen to anyone. Thank you for watching.